In today's video, I'm going to show you how to lift your face with osteopathic massage. Our bones, like muscles and skin, are able to regenerate. Bone cells actively divide if there is a load on bones. In simple terms, our skull bones, just like our muscles, need to work and be under constant load. For example, if you lose a tooth, the bone, namely our gum, begins to deteriorate in that place, so that there is no resorption and the bone is not destroyed. We need to put pressure on it with osteopathic massage on a regular basis. This massage can be done twice a week, allow 2-3 days for recovery. You can apply a small amount of cream and wait until it's absorbed. Watch the timer and do this beautiful massage with me. Step 1. Place the base of your palm on the back of the head. Now make the powerful motions that resembles the figure 8. And at the same time, squeeze the back of the head. I do hope you understand what I say. Sometimes my English is not sufficient to explain some difficult techniques. I'll repeat you again. It's as if we are drawing a figure 8 in the air. In this way, we are giving a powerful massage to the aponeurosis of the occipital. And remove tension from the forehead area. Try it yourself. You are going to feel amazing relief after this technique. Step 2. Here we have a skull suture. To get rid of under eye bags, we need to relieve tension from the bridge of the nose. Hold the orbital area with your fingers. It's as if you want to lift the frontal bone with hooks in this way. Make gentle swinging motions and pull slightly in opposite directions. There is no need to pull hard. In osteopathy, everything is done with very gentle movements. Our body understands this movement very well. This is not only gets rid under eye bags, but also relieves headaches and relaxes. Step 3. Now we work with the nasolabial folds. In this trajectory, we have a skull suture. It connects the upper jaw to the cheekbone. Fix the soft tissues here near the bridge of the nose. Hold the cheekbone with other hand and make a gentle movement as if you are trying to move this bone up and to the side, while swinging it at the same time. Here we are working in several directions at once. We lift the cheekbones, make our face more defined, as if with age the face becomes flat. Then we tighten the cheek muscles And of course, reduce nasolabial folds. And now we do the other side. Okay, fix the muscles and move your cheekbone up and to the side. And as I told you before, this is no need to pull hard. In osteopathy, everything is done with very gentle motions because our body understands these motions very well. And don't forget to breathe. Step 4. Grab and clamp the lower jaw with these hooks and start to swing it. First, I show you how to do it on the skull. Okay, rock it in circular motions in this way. Clap your bone very tightly, like a vise, and gradually go to the periphery. You must feel your bone. It's very important to enhance our mandibular bone. This is especially useful for those who are missing at least one tooth in the lower jaw. And if you have chance, put your elbow on the table. Please take your time and do this step at least 2 minutes. Step 5. Then we are going to work on this protrusion of the lower jaw, right here, just below the cheekbone, at the junction. Place your finger hooks here and form the mouth into an oval. You should feel these hollows. Tilt the head forward, and millimeter by millimeter slide toward the periphery. It may hurt. This is because there is tension in the bones and muscles, and the chewing muscles are also attached here. If it hurts a lot, please reduce the pressure. There is no need to endure it. And please take your time. Do it slowly, millimeter by millimeter. Actually, it's a very effective technique. And again, if you have chance to then put your elbows on the table. There is very important to have support for your hand. And one more time. Step 6. Now we need to lift the cheekbone upward. With age, these bones become porous, less dense and sink inward. As a result, our muscles lose their bony support, have nothing to hold on to, and begin to sag. That's when sagging jaws and nasolabial folds appear. First, I'm showing you how to do it on skull. Okay, place your elbows on the table and rest your entire face on your fingers, right under the cheekbones. And you can hold this position for up to 2 minutes. Over time, your bones will recover and your cheeks will be tightened. Gradually move toward the periphery. Do it slowly, take your time. As I told you, you can do it 2 or even 3 minutes. Step 7. Now I'm going to show you an amazing technique for facial asymmetry. Look at my face and you will immediately see that it's asymmetrical. But in fact, this asymmetry used to be much stronger and more noticeable. So we have the temporomandibular joint located right here. This joint allows us to open and close our mouth. We need to place the fingers in these hollows. When we open the mouth, our fingers sink into this recess. And we slowly open and close our mouth. Many of us have dysfunction in this joint, especially if you have no teeth and chew on only one side. Sometimes it can be even displacement of the lower jaw, and so on. This way, you relieve tension from the chewing muscles and take the load off the joints and restoring symmetry to your face. Step 8. The orbital region ages the fastest because the bones around the face deteriorate and eye socket becomes larger. As a consequence, the eyes fall inward and there is a kind of extra skin. Although we don't have extra skin in our early age, with time our eye socket becomes bigger and due to this extra skin appears. We have droopy eyelids and flabby skin. So now we are going to work with the orbital eye area and reduce bone resorption. Place your thumb on the bone. The fingers should be just below the base of the eyebrow, closer the bridge of the nose. Don't put pressure on the eyeball. You should feel the bone. Hold like this for about approximately 2 or even 3 minutes. Put your elbows on the table, tilt your head forward, and feel relief. It's so pleasant. But make sure the skin between your eyebrows doesn't wrinkle. Step 9. As I told you before, due to age-related bone resorption, the bones become thinner and more fragile, and the eye socket enlarges. The eyes sink inward, excess skin appears, We have droopy eyelids and the skin becomes loose. That's why it's very important to put some load on the orbital bone. You should feel the bone. And to prevent your fingers from slipping, you need a support, for example, a table or your own body, like I'm doing. Don't put pressure on the eyeball. And please try to not move your skin back and forth. You only work with periosteum, not with skin and muscles. You must do entire eye socket. Okay, and now do the other eye. Step 10. Here we have the stylohyoid muscle which tightens and spasms and shortens and pulls the jaw back. Our muscles have nowhere to go, and that's where the sagging jaws form and sagging skin appears. Place your fingers just inside in this way. As you can see, my fingers sink in almost a third of the way. If you have spasm or swelling, there you may not be able to insert your fingers deeply. However, with the time you will surely succeed. So, from the inside of the angle of the jaw, put your fingers, and as you stretching the lower jaw, at the same time create light vibration. If you feel pain, then don't do too much pressure. Step 11. This upper jaw is called the maxilla, As we age, the bone there becomes loose, the bone's density decreases. It falls inward, the face becomes flat, and nasal folds aggravated. Place your fingers on the upper jaw above the teeth and create a load here. Make circular motions at the same time. When we work on the bone density is restored. Of course, it doesn't happen all at once in one, but slowly, millimeter by millimeter. If you have chance, put your elbows on the table and move gradually to the periphery. I don't have any online courses or private videos with paid access. I share all my knowledge on this channel, and it's important to me that my videos are useful for you. I do hope you enjoy this massage. Take care and bye for now.